Hi, everyone. Thank you so much for joining us this evening. We're going to get started on tonight's webinar. My name is Kier. I'm the Director of Client Care and Operations at Bosner Health. And tonight we are joined by the amazing Chaitali, our homeopath at Bosner Health. Tonight's webinar is going to be on seasonal allergies and homeopathy. And Chaitali, I will let you take it away.
Thank you, Kier. Hi, everyone. So I'm Chaitali, and I'm the homeopathic practitioner at Bosnar Health. And I'm just going to start sharing my screen so that, okay. All right. So here we are. So I've been a homeopathic practitioner for since like 2014. No, I'm sorry, 2010, 14 years. And I've done my bachelor's in homeopathy from India. I'm licensed in Canada with Ontario and BC. So in Ontario, I'm licensed with the College of Homeopaths of Ontario. And then in BC, I am also registered with the Canadian Society of Homeopaths. I have a special interest in children's health, women's health, and chronic diseases. I've presented a fair few papers with, some national and international forums of homeopathy, and I've also published a few articles. So that's about me. We can start with the topic for today, which is seasonal allergies. Now, what exactly is seasonal allergies? As the name suggests, these are allergies that are triggered in certain seasons. So why in certain seasons? It's because the most common allergens that trigger these allergies are found, they're more prevalent during those seasons, like the springtime or the change from summer to fall. These are the more prominent durations of the year. But having said that, seasonal allergies generally tend to become chronic. And then there are people who suffer from it almost 365 days in the year. So basically, what are allergies? Allergies are a result of an overactive immune system. So the job of our immune system is basically to defend us from the harmful pathogens like, certain bacteria, fungi, etc. But what happens is, in certain cases, the immune system becomes overactive, and then that leads to an exaggerated response from the immune system. And this is what causes allergic symptoms. So basically, things that we are exposed to on an everyday basis, but we don't react to it. An overactive immune system will react to these things. So, for example, pollen or dust or like pet dander or mold, etc. And then the intensity of these symptoms would depend on the pre-existing condition of the immune system, as well as the quantity of the allergen that we are exposed to, and the duration for which one is exposed to the allergen. So, for example, if you are oversensitive or hypersensitive, rather, if your immune system is hypersensitive to a certain allergen, even a slight amount of the allergen exposure is going to trigger those allergies. Or if you are hypersensitive, maybe a small amount may not, but if you're exposed to it over a longer period of time, then it's going to trigger allergies. So it really depends primarily on the condition of your immune system, but even on the kind of allergen that you are being exposed to and the duration for which you are exposed to. Allergies are very common in children, simply because up till a certain age their immune system is developing. So it's not necessarily a bad thing when it's in children. However, if it's very recurrent, then yes, then that is not a normal thing. But again, allergies can be triggered at any age, in any gender. It can happen anytime. We spoke about the common allergens, which is pollen, dust, pet dander, mold, some fragrances, etc. Even irregular hormones in the body, stress, smoking, perfumes, all of these things can also add to, the severity of the episode of the allergic, of the seasonal allergy. So what happens if somebody is having an episode of seasonal allergy? The most common symptoms would be sneezing, runny or like stuffy, nose, watery, itchy eyes, itchy sensation in the throat, in the ears, in the nose. You always feel that discharge kind of dropping from your nose back into your throat. These are the more common symptoms. Most probably, the patient wakes up with these symptoms, and the mornings are the worst part of the day. With time, as the day progresses, these symptoms tend to get a little bit better, but they're always worse in the morning. And then in the more severe episodes, the patient could have headaches, like it could trigger migraines. There could be shortness of breath, especially with patients who already have pre-existing lung conditions. There could be wheezing, severe coughing bouts. Patients with allergic tendencies can experience allergic rhinitis, which is basically like a runny, watery discharge from the nose constantly all year round. And it can also trigger asthmatic episodes. So yeah, seasonal allergies are pretty bad. So how does homeopathy help? With homeopathy, there are two ways of two steps of the treatment. So first and foremost, of course, we want to give the patient some relief, because it's a terrible way to live, especially for people who are having this on a more daily basis. So we definitely want to first directly impact the specific symptoms of the patient, and provide some relief. And then once we have achieved that and the patient is a little bit more comfortable, the second step would be the more long-term solution, which is basically to modify the patient's immune system. Because clearly this is a hyperactive, hypersensitive immune system. So we have to teach the immune system what is an allergen and what is not. Like, why is it that most people do not react in that way to that amount of dust, but only this person is reacting that? So that's clearly because the immune system is not able to identify what is a friend and what is not. So that's what we have to teach the immune system. And that's where homeopathy has shown to have tremendous results. Like we have a lot of studies that have shown that these symptoms have gone down considerably, and as well as the frequency of these episodes goes down, which simply means that the body has stopped overreacting to these exposures. So that is why we generally call homeopathy as an immunomodulator, because it really depends on the condition. Like, there are a lot of other chronic conditions, like say arthritis and IBS and stuff like that, where the immune system is actually underworking. Like, it's kind of depressed, and you have to stimulate it to really act efficiently. So, but in the case of seasonal allergies, the immune system is actually overworking. So you have to kind of tone it down. So homeopathy basically can work for both the situations. And that is why, I like to call it more immunomodulation rather than stimulation. That's generally the term people use, but I would say it's more of modulation, because it can actually modulate it based on the need. And then what happens? What are the effects of homeopathic treatment? So, like I mentioned earlier, that there have been a lot of research and studies about this. The first and foremost effect that one is going to see, and which of course is what we want, is that the patient finds relief with the symptoms. The immediate responses that is what we are looking for. So there will definitely be a reduction in the intensity and frequency of the allergic reaction. That is like a marker to really say if the treatment is working for you or not. Because if you're not going to see any response, any any change in your everyday issues, that's really not really worth waiting for, right? Like, you want to see that response. And then it enhances the body's immune response and reduces the hypersensitivity. So again, these can be found, like by running some blood work and stuff like that. Like, we can look at the histamine levels, we can look at the eosinophils, We can look at the IgE levels. All of these things are indicators of showing that the hypersensitivity of the immune system, which is being manifested like an allergy, all these cells, the levels of these cells will come down eventually, which means that the allergic reaction is coming down. Homeopathy treats allergies based on the characteristic individualized symptoms that the patient experiences. So, for example, I listed like a good 10, 12 symptoms that could all be a part of seasonal allergies. However, not everybody experiences all of these symptoms. So like I could experience 3 of those and somebody else could experience just one, but which could be the asthmatic trigger. So it really depends on the patient. But what homeopathy does is it individualizes, like the treatment plan, the protocol that we would come up with would be very individualized based on what the patient is experiencing, and not like a blanket treatment for, okay, you have seasonal allergies, this is the medicine you're going to take. So it's more holistic, it's more individualized in that sense. It's, there's a gradual and persistent relief of symptoms, which is very important because gradual and persistent. You can't be having like, okay, there's a relief and then it's all back to square one. That doesn't make sense. That's pretty useless. And then, of course, there's a general feeling of wellness. So this, again, is a very big indicator for any condition. When you're getting treated for a certain condition, you can't have your primary symptoms going down, but a general feeling of not feeling good. That is not how your body works. That's not really where your treatment should be going. Sometimes it is possible that your primary symptoms are still not, they're still not showing that kind of progress. However, you're feeling better. Like, you're feeling more, say your sleep pattern is better, your appetite gets better. There's just a general feeling of wellness. That is really an indication of a treatment going in the correct line. So these are, if you go to experienced and authentic, like a real homeopathic practitioner, and if they are able to skillfully give you the correct remedy, these are the symptoms, these are the effects that you're going to really look out for. So, these are just some of the examples of what kind of homeopathic remedies could be used. Of course, these are all based on symptoms, and I would not recommend to self-medicate because these are very, very individualized. Each remedy is very different from the other. So if you need one, but if you're going to take another one, it's not going to have much of an effect for you. So to understand which remedy is actually going to help you, that's where the skill of the homeopathic practitioner comes in. That's where, the whole study and the understanding of the science is important. So, but some of the commonly used remedies, and these are also all available over the counter, are arsenic album, apis, hepar sulph, calcium bichromicum, pulsatilla, silica. These are basically all made from either minerals, plants, or animal extracts. So they are, all natural, and they're super dilutions and super potentized. So which means that, the adverse effect of these remedies is practically nil. But however, they do retain the therapeutic value, the therapeutic dosage to cause enough effect in the body, to kind of trigger that treatment, or that feeling of getting better. So, for example, there's been a study that has been published in the European Journal of Pharmacology that has shown that homeopathic medicine silica stimulated macrophages. So macrophages are the body's immune cells, which will engulf the bacteria or foreign substances. So again, it is a type of immune cells that, the immune system secretes when it is exposed to certain harmful bacteria. So like I was explaining, that we can, all of this can be put on paper by doing blood work and seeing that there are actually difference in the type of cells depending on what you're trying to treat. So this is one such study. And then, of course, the popular quick fixes treatments are available. Of course, there's oral antihistamines, because when you have allergies, the one cell, the instant reaction of the immune system is to secrete histamine cells. And histamine cells are the ones that cause that itchy sensation, whether it's on your skin, in your nose, in your ears, wherever. So, the most obvious counter to that is antihistamines. Or, generally there's stuffy nose. So people tend to use sodium nasal sprays, because sodium tends to pull out the water or the, secretions from the nose. So, which is definitely helpful. There are oral decongestants, there's corticosteroid nasal sprays, which are for more severe episodes. And of course, there's oral corticosteroids in really severe cases. All of these are very easily available. They are very quick fixes. However, they will only provide short-term relief. And over a period of time, when these are used recurrently, they are definitely going to have adverse effects from long-term use. And yeah, so, but what exactly is homeopathy? It's a it's something that I studied for 5 years, so it's difficult to explain it in really short. But basically, homeopathy is based on three fundamental principles. The first one is the law of similars. So the law of similars is basically, how this whole theory and this whole basis of homeopathy came into existence. So Dr. Samuel Hahnemann, who is the founder of homeopathy, he was a medical doctor, and he started conducting certain experiments. And what he found was that certain medicinal substances that are available in nature, when you administer those substances in a healthy body, it gives rise to certain symptoms. And when those same substances are super diluted and potentized, and they are given to a diseased individual that has those same set of symptoms, they can actually help to get rid of those symptoms. So they can actually help to treat the individual to get better from those symptoms. So I know it sounds a little complicated, but it's a very it's something that he came up with like hundreds of experiments that he experimented on himself, on his fellows, his colleagues, and this is basically a law that he came up with, and this is what we are able to see in practice for this has been over 250 years or so, that medicinal substances that can produce certain symptoms can also help to cure those symptoms. The second law is the law of single remedy, which basically means that for a certain individual experiencing a certain set of symptoms, there can be only one remedy that can help with that. So you can't have 5 different remedies treating 5 different symptoms, because they're going to interfere with each other and they're eventually not going to help the patient. And this is why this is about homeopathy. So this is one of the very basic things of homeopathy, and this is why the skill of the person is really, really important, because finding that one single remedy which completely matches with those symptoms out of over 5,000-6,000 remedies, that really needs some kind of understanding and study. So but that is when you will actually see the actual effect that is desired, that is required. And then the law of minimum dose, which is basically that a medicinal substance, a very small amount of the medicinal substance is enough to stimulate the person's innate healing response. So all of us have that in ourselves, like that's how a human body works. But for whatever reasons, that gets, it gets suppressed. So there's only that little bit stimulation that is required, and that can be attained from a very small dose of the medicinal substance. You don't need to, overdose the patient, like giving, lots and lots of different kinds of drugs, a lot of different amounts of drugs. It's not required. The body has the ability. All you need to do is give that little push. And so basically, it is these three main principles which help which the homeopath will take help from to decide what is the remedy, what is the dose, and how this treatment is going to go ahead. And then what happens when you come for a typical homeopathic consultation? So the first consultation generally would go on for 60 to 90 minutes, sometimes even longer. And that's because we discuss every possible aspect of your health. The primary physical complaint, of course, which brings you to a healthcare practitioner. But then apart from that, every other physical complaint, which to you may be related or unrelated, but everything is important for your homeopathic practitioner to find that one remedy that will help you in this moment. Of course, your past medical history, your family medical history, your mental health, your general well-being, habits, your lifestyle, your social well-being, all of these, and then of course the clinical examination as a healthcare practitioner, that is very important. So putting all of this together, that is the picture of the patient in that moment. And that is what we need to treat. It cannot be, homeopathy is not like, like we like to say, like we don't treat the disease, we treat the person. And by person, it means all of this. Like if your allergies are making you feel sad, that is important for me to know. But if your allergies are making somebody else feel angry and irritable, that is important for me, because that will help differentiating between different remedies. Because everybody's response is different, right? Physical, emotional, in every way. So that's how it is individualized. That's how it is, the totality is important. And of course, your physical symptoms, clinical manifestations, clinical examination, all of that is very important. And then once you take a homeopathic dose, there are mostly three outcomes that we encounter. First, and the most favorable, the most desired, is a gradual, gentle, and progressive relief of symptoms, which is basically tending towards recovery. The second is an initial aggravation. So this is an interesting reaction, because what happens is sometimes, like how I was explaining that that slight dose, the law of single dose. So that minimum dose is, of course, it's difficult to judge, right? So sometimes, we may tend to give the patient a slightly higher dose than what was required. In that situation, the patient's body is overstimulated. The system is overstimulated. And hence, in the beginning, there might be a slight aggravation. However, it is immediately followed by a gradual relief of symptoms. So the body is healing is stimulated, and the body is able to overcome that. So as long as you're seeing a relief, that's again a good sign. But this is of course important for you to let your homeopathic practitioner know, because they will be able to decide and judge whether this is okay, is worth waiting for a day to see if there's a gradual relief or not. Because if it is the third case, which is the remedy reaction, which is very rare to be honest, because again, these are really diluted and very potentized doses. So they're very small doses. So the possibility of them adversely affecting the body is practically nil. Theoretically, no, but practically, I don't think there's ever been anybody who has seen any kind of an adverse effect from a homeopathic remedy. But of course, if you do see, a sharp increase in symptoms and you see that it is not resolving, there's no gradual relief, this sometimes could happen because maybe the remedy that was given was not accurate. It did not, it's like a jigsaw puzzle, and it has to match exactly with your body, with your situation in that moment. So sometimes, that may not happen, and it's important for you to let your practitioner know, so that the change can be made immediately without wasting any time. So that's pretty much what we expect from a homeopathic consult, and then the protocol. So that's it from me. If anybody has any questions, I'm happy to answer them. You wanna I don't know. I think I saw something in the chat.
Yes, there is a question. Chitali, just a quick question. How do we
Mhm.
know when an allergy is cured completely?
Oh, that's a great question. There are two ways. One, of course, there will be symptomatic relief, and there will be a point where you don't experience those allergies anymore. So, for example, if you were somebody who was getting these allergy bouts every spring, and then say you've been taking homeopathic medication, and the next spring you do not experience any symptoms, great. That is a very big sign to uh, you know hope that your allergies are getting resolved. However, just symptomatic relief is not the only way to check that. uh, there must be blood work, there must be like on paper you have to know that. So when your allergies were diagnosed, there would have been IgE levels, there would have been the eosinophil levels, which would have been very high. So if you're seeing that, okay, you're not getting the symptoms now, talk to your medical practitioner, get your blood work done, and that will be the real indicator to compare. If your allergies are getting resolved, apart from the symptomatic relief, you'll 100% see a reduction in those levels on paper. And if they are within your normal range, if they've gone back to normal levels, great. You're done with your treatment, you're doing great, and you don't need to do it anymore.
Thank you so much for answering that question for us. Have a wonderful night, everyone who joined us. I hope you found this really supportive. If you have any questions, you can feel free to reach out to us at Bosner Health, and you can book an appointment with Chaitali at bosnerhealth.com. Have a wonderful Wednesday evening, everybody, and thank you so much for this awesome webinar, Chaitali. I appreciate it.
No worries. Thank you, everyone, for joining. Good night.
Good night.